The plane of pelvic inlet is called pelvic brim. It divides the pelvis into false pelvis above the brim and the true pelvis below the brim. The boundaries of pelvic inlet starting from anterior includes symphysis pubis, pubic crest, pubic tubercle, pectineal line, iliopubic eminence, arcuate line, anterior border of ala of sacrum, and sacral promontory. Regarding diameters of pelvic inlets, there are anteroposterior and transverse diameters. There are three anteroposterior diameters. The true conjugate is the distance between the sacral promontory and the upper border of symphysis pubis. It measures 11 centimeters and it cannot be measured clinically. Obstetric conjugate diameter is the distance between the sacral promontory and the prominent projection on the inner surface of the symphysis pubis. It also cannot be measured clinically, and it measures 10 centimeters. Diagonal conjugate is the distance between the sacral promontory and the lower border of symphysis pubis. It measures 12 centimeters, and it can be measured clinically by introducing two fingers trying to palpate the sacral promontory, which normally is difficult to palpate. The distance between the tip of the middle finger and the area under the symphysis pubis correspond to the diagonal conjugate. Diagonal conjugate also can predict other diameters. I mean, the true conjugate is the diagonal minus 1 centimeter, while the obstetric conjugate is diagonal minus 2 centimeters. The transverse diameter of the pelvic inlet is the distance between the two farthest points over the iliopectineal line. It measures 13 centimeters. The oblique diameter extends from one sacroiliac joint to the opposite iliopubic eminence and measures 12 centimeters. The sacrocotyloid diameter is the distance between the midpoint of the sacral promontory to the iliopubic eminence. Pelvic cavity is a segment between the plane of inlet above and the plane of obstetric outlet below. The plane of obstetric outlet is known as plane of least pelvic dimension. The widest area in the pelvic cavity is known as plane of greatest pelvic dimension. It is an imaginary plane from middle of posterior surface of symphysis pubis across the center of acetabulum to the junction of the second and third sacral pieces posterior. It has an anteroposterior diameter which extends from the midpoint on the posterior surface of symphysis pubis to the junction of the second and the third sacral vertebrae posteriorly. It measures 12 centimeters. The transverse diameter also is about 12 centimeters. However, it cannot be precisely measured as the point lies over soft tissues covering the sacrosciatic notches and obturator foramina. The area between the two planes, I mean between the greatest pelvic dimension and the least pelvic dimension, is known as mid-pelvis. The pelvic outlet is a segment bounded by the plane of obstetric outlet above and the plane of anatomic outlet below. The plane of obstetric outlet is called plane of least pelvic dimension. It extends from the lower margin of the symphysis pubis through the level of ischial spines to end at the tip of the sacrum. The transverse diameter of the plane of least pelvic dimension extends between the two ischial spines and known as interspinous diameter. It measures 10.5 centimeters, while the anteroposterior diameter extends from the lower border of symphysis pubis to the tip of sacrum, and it measures 11.5 centimeters. The ischial spine is clinically important. It is the plane of least pelvic dimension, which is the narrowest plane in the pelvis. It corresponds roughly to the origin of levator inni muscles. The level of ischial spine indicates station 0. And when the presenting part reaches the level of ischial spine, internal rotation will occur. It marks the beginning of the forward curve of the pelvic axis, and it is a landmark used for pudendal nerve block. The plane of anatomic outlets extends from the lower border of symphysis pubis through the ischiopubic rami to the ischial tuberosity, through the sacrospinous ligaments, to end at the lower end of the coccyx. It has an anteroposterior diameter extending from the lower border of symphysis pubis to the tip of coccyx and measure 11.5 centimeters, and a transverse diameter extending between the two ischial tuberosities and known as bituberous diameter, and it measures 11 centimeters.